In today's news, another COVID-positive individual passes in the BVI.
As of today, July 8 at 8 a.m., the BVI has officially recorded 821 active cases of COVID-19.
And COI hearings continue with strict COVID-19 measures, but attorneys must now attend hearings virtually.
Dr. Pickering, of course, former legislator and medical practitioner, is now saying that the spike is a result of our failure to get vaccinated and supports employers' decision on vaccines. All that and so much more on today's edition of 284 News.
The win
is about these people.
It's always a pleasure coming to you live and direct from the
What's poppin', what's really good?
Davis has won it for the Lakers.
Welcome everyone, it's Thursday, July 8th, 2021. I'm Kamal Haynes.
And my name is Javon Wilson. A beautiful day in the Virgin Islands. Lots of updates coming out within the last 24 hours. So, of course, we'll be bringing those updates to you. But before we dive into our newscast, viewers, we want to confirm now that of the active cases, we're now seeing that number up to 821. With 8 persons now being hospitalized. As we pan over, we do see health officials as well making haste. Emergency health facilities being set up at the Multipurpose complex to test and house sick patients amidst the recent surge. And finally, our newsroom has been reliably informed that a patient who actually tested positive for COVID-19 has died while receiving care at the intensive care unit. Now, based on information, the deceased was on a ventilator due to the severity of his symptoms. We are actually, viewers, in receipt of the victim's identity, but will respectfully withhold until an official update is made. 284 Media would like to extend sincere condolences to the family and friends of the deceased. We're going to head straight into our newscast for today. Now, the vaccine does not protect you from COVID-19. It reduces the severity of your symptoms and prevents death. Now, these were the words of medical practitioner and former legislator, Dr. Pickering, who sat down with us earlier today for an exclusive discussion on the recent spike in COVID-19 cases and, of course, our rush to flatten the curve. Listening.
Early on, probably a year ago,
Yes.
saying that the BVI should aim to be the first country in the Caribbean to be fully vaccinated. We had the opportunity, we had the vaccines were available for us at the appointed time, and all we needed to was make a decision to get vaccinated, and for whatever reason, we've dropped the ball, and now we are where we are.
Yeah. You mentioned that we have failed in that regard, and clearly there is lots of hesitancy when it comes to taking the vaccine. If we look at the numbers, based on our population, just about, we would say just under 30%, little under 30% is fully vaccinated. I believe those numbers are correct. It's just about 10,000 or right under 10,000. Why do you think persons are so hesitant to take this shot?
You know, I wish I knew, because if I knew, I'd be able to help, you know, to encourage others to become vaccinated. Let me pause at this point in time to state categorically that today is exactly 11 weeks since I have been fully vaccinated. My entire family is vaccinated, and all those close to me who I've had the opportunity to speak to and encourage are fully vaccinated. And I want to go a step further, Javon, and say that based on current scientific evidence, they're now suggesting that if you've had one vaccine, you've been fully vaccinated, taking a different vaccine can act as a booster and add added protection. And I will take whatever other additional vaccine that I can get, whether it's Pfizer or Moderna, at the appropriate time. Once I can get the booster from that particular vaccine, I will take it, because
Wow.
I understand from a medical point of view how dangerous COVID is. And we have in our armamentarium a weapon against COVID. It's called the vaccine.
You just mentioned that based on medical investigations recently, that you could actually use a second or a different brand of the vaccine as a booster. Did I understand you correctly?
Absolutely. In fact, no less a person than Chancellor Angela Merkel of Germany was one of the first persons to have done it, and she's a physicist.
Okay.
The new evidence is pointing in the direction that you get added protection against all the variants if you take a different vaccine. So if you've had Pfizer and you take AstraZeneca, and vice versa, if you have had AstraZeneca and you take Pfizer or Moderna, that you are in fact boosting your immune system even more to protect you against the invasion of the virus into your body.
All right. Now, viewers, Dr. Kedrick Pickering said with the cases now up to 821, he believes that our refusal to get vaccinated is the prime cause. He also mentioned that getting different brands of the vaccines actually increases our immunity based on new medical information. Listening. I want to look at the breakdown of the numbers that we have currently, and viewers will be able to see the flyers shortly. 821 cases. The flyer is not necessarily showing how many persons are vaccinated, but based on the CMO's recent statement, you can see over 20% of persons who were fully vaccinated actually contracted the virus. Dr. Pickering, do you think that is a cause for concern? And if so, what actually would be the benefits of taking the vaccine if so many fully vaccinated persons are now testing positive?
And it's probably the most important question that you will ask all afternoon. And from the very inception, all of us who have been on the front line trying to encourage people to take vaccines have been very deliberate in explaining that it doesn't matter what vaccine you take. Vaccines do not protect you from coming into contact with the particular pathogen, the particular agent, the particular virus. What the vaccine does is it boosts your immune system in a way in which it tells your body that if this particular pathogen, if this particular enemy invades your body then mounts a fight against it. So if I get the virus, I do not expect to get sick. That is the difference. That is what the numbers means. That if you are vaccinated, 90-something% and upwards of persons who have been fully vaccinated can expect not to get sick. And even if you get sick, you will just have mild infection. After all, it is important to emphasize the point that the key to this particular situation is we are trying to prevent people from getting sick. We're trying to prevent you from ending up in hospital. We're trying to prevent you from ending up in an intensive care unit, because the chances of dying, if you get to that point, are more than 50% and upwards. That is what vaccination is all about. Vaccines and vaccination has never been designed to stop you from coming into contact with it. Nobody can stop that. The virus is free floating, but the vaccines provide for your body a warning system that tells your body that if this robber, if this invader enters into your territory, which is your body, fight it off and fight to the death. That's what vaccination does. That is the point that we want to emphasize to get you to understand, so that if you are fully vaccinated, you do not expect to end up in hospital. You certainly do not expect to end up in the intensive care unit.
Very strong comments as we continue to examine the reality on the ground here. 821 cases as of today. A very dire situation, Kamal.
Indeed, very much so. And we can see in the population today, when you go around these streets of BVI, basically ghost town.
Yes, complete silence.
Well, now to news of the COI. The Commission of Inquiry has adopted stringent COVID-19 safety measures for all future hearings following the rapid increases in positive COVID-19 cases in the territory. The Secretary to the Commission, Stephen Chandler, made the announcement in a press release dated Wednesday, July 7th, where he outlined some of the new measures to be taken going forward. But these include the utilization of remote technology to facilitate virtual hearings and a new policy which only now allows one witness to be present at in-person hearings. Well, he said, and I quote, "Witnesses are still able, if they wish, to give their evidence in person at the International Arbitration Center, but can now choose to give their evidence remotely via video link. Additionally, in order to keep to a minimum the number of people in the IAC and in the hearing room at any one time, witnesses' legal representatives can now only attend remotely via video link. They will not be able to attend in person even if a witness whom they represent decides to give evidence in person. But the IAC is also currently limiting general access to its premises to key card holders only," end quote. But Chandler also stated in the release that even before the recent spike in cases, all visitors to the inquiry were required to adhere to strict COVID-19 measures. With these included the wearing of a mask or face covering, hand sanitizing on arrival, and registering at the IAC reception. Additionally, social distancing is practiced in the hearing room and across the IAC at all times, and the room is cleaned thoroughly at the end of each sitting day. But following the spike in COVID-19 cases, persons have been called for the BVI government to suspend cooperation with the COI to focus on the pandemic.
All right, viewers, still ahead, the BVI Health Services Authority is now eager to get mandatory vaccinations for all frontline staff. And Dr. Kedrick Pickering, very strong comments as it relates to the recent precedents of businesses forcibly encouraging employees to take the vaccine. All of that and so much more right after this commercial break.
The wait is over. CCT Fire is here. Experience ultra-fast downloads, seamless streaming, and even more reliable connectivity on an all-new fire-blazing super-fast CCT Fiber network. CCT Fire. Bring it home and upgrade today.
Welcome back, viewers. Executive personnel within the BVI Health Services Authority are calling for the mandatory vaccination of all their frontline workers. But this is according to the Health Minister, Carvin Malone, who made a statement during a VIP Let's Start radio program on Tuesday, July 6th. Malone was speaking on the importance of having medical personnel fully immunized, especially those who are tasked with dealing with vulnerable residents, such as the elderly. Listen in.
There are protocols that the Deputy Governor and the whole entire public service have been coming to grip with as to whether or not we have testing regimens, whether it's once fortnightly or have it done every week or every 2 weeks with the rapid tests to be done. But the most effective way is to have everyone fully immunized. We have resisted in terms of the mandatory. I know that the executive staff at the hospital is yearning out for when we can have a particular mandatory vaccinations for the persons in the Health Services Authority. There are persons who are crying out for this. If we don't do this, we'll have to do the PCR test, whether it's weekly or bi-weekly or fortnightly, as we say.
Well, the minister also said if health workers continue to be hesitant towards getting inoculated, a COVID-19 testing regimen will have to be instituted to ensure the protection of the vulnerable patients.
But in protection of our golden gems, the optimal, the best way to do this will be to have everyone who is serving these persons to be able to be immunized so that they themselves would not catch it as easily, number one. Although we know that it could be transferred, still, all of the particular, once you have the approval of the caregivers of the elderly to have the elderly immunized, then the layers of protection, because the herd immunity will be within the facility. All 18 residents and all of the staff members, then we have a better chance of making sure that they themselves are not contacting or contracting the particular disease.
Well, meanwhile, Deputy Premier Dr. Natalia Whitley said that some persons have both been very uncomfortable with the idea of getting tested and taking a vaccine, and warned that such practices were not fair to patients.
We have a testing regime, and some persons have been uncomfortable with the idea of being tested regularly, and they're also uncomfortable with the idea of getting vaccinated. But I just want to say, Minister Malone, it's not fair to persons who have their family members in the home, where these persons will be exposed to persons who do not want to vaccinate and they do not want to test. So you're going to have to test, because it's responsible in a place like that for us to know your COVID status, so that we don't bring COVID-19 in a place like that where it can spread and cause great difficulties to families.
Well, now to news where we see yet another local business mandating for its staff to be vaccinated. Well, that is OneMart Supermarket, who joins the list of businesses that have requested for their staff to be fully vaccinated or face suspension from work. Well, staff from the supermarket contacted our newsroom with the reports, which were later confirmed by the management of the supermarket following inquiries. Well, according to the management, the letter was sent to staff members on June 30th after the territory has started to see an increase in positive COVID-19 cases. It stated, and I quote, "Please note that as a company, we have to make decisions in the interest of our customers, yourselves, and the business. I must emphasize that while we appreciate that persons have medical and other reasons for not vaccinating, the safety of our customers and staff will always be top priority. With staff who do not get their first vaccine shot by close of business on Saturday, July 3rd, 2021, and their second shot by July 31st, 2021, will not be scheduled to work until further notice," end quote. Within the letter, there were also exemptions made for persons with medical or religious reasons who had to inform management of the circumstances by following an in-house procedure. With the letter will continue, and I quote, "Persons who have medical reasons for remaining unvaccinated are required to submit a confidential medical report for consideration. Also, persons who have religious reasons for remaining unvaccinated are required to submit supporting documentation from your religious institution for consideration. But these requests should be submitted to the operations manager and will be handled in the confidence on a case-by-case basis." Well, just yesterday, it was reported by our 284 News team that LJDVI Block, which is located in Boggers Bay, Tortola, ordered all unvaccinated staff to be vaccinated with their first dose by July 10th, 2021, or not return to work.
Very interesting comments, and also adding to those businesses, hospitality businesses in particular. We've seen some of focused, I think in Virgin Gorda in particular, really asking for the same thing, saying that, you know, if you're not about to take the vaccines, we cannot schedule you to work. And I think very strong sentiments. Now, viewers, despite the public backlash that has followed business owners essentially forcibly encouraging employees to now take the vaccine or risk being jobless, medical physician Dr. Kedrick Pickerin has said that businesses have a right to protect themselves, even if it means not retaining staff who are unvaccinated. Very strong comments indeed. Listening. Quite a number of businesses, OneMart being the most recent. We have seen LJDVI Block and many other hospitality-centric businesses in the territory setting a precedent, a very strong precedent, and essentially forcing employees to take the vaccine or, you know, risk losing their jobs. And this has been confirmed by our newsroom, many of these businesses, and we do know that the government is also yet to take a public stance on this. How do you feel about companies now mandating vaccination? And is this the message that we should be sending while it remains a personal decision?
Look, there are two ways to look at this. Number one, there's something called health and safety protocols in the workplace, and the labor code speaks to the issue of health and safety. If you go on a construction site and the construction site mandates that you must wear a helmet and you don't want to wear your helmet, nobody has any obligation to keep you on the job site because you are not adhering to the rules and regulation of the particular employment state. If you go to the airport and you see somebody who's supposed to be working at the airport and they don't have on their covering that shows that they are not only an employee, but it is for their protection and the protection of others that they can be seen from a distance. It is extremely important because it is a warning, it is a hazard against what may or may not occur. You have to do it. If you don't do it, you could be fired summarily in those situations. The police officers who have to wear guns, they have a protocol that they have to abide. When they're finished with their weapons, they have to store it in a way, otherwise they lose their job. So the situation that we are in right now is no different. It has to do with health and safety in the workplace. And so every employer has to protect its employees, and the workplace has to be safe for those employees and the customers that may visit that particular station. So if the employer does not do that, they themselves are putting themselves at risk of other problems if they don't protect everyone in that context. So in the present situation in which we are in, where employers are making the decision that if you don't want to be vaccinated, then it's difficult for us to keep you, they are within their own rights to do exactly that.
What about now, Veers? While the labor code seemingly gives businesses the right to protect themselves, residents are adamant that their human rights should remain protected under the Constitution. Plus, the government of the Virgin Islands has maintained that the vaccines are not mandatory, but is yet to take a public position on the new precedents being set by employers. Now, this is what Dr. Kedrick Pickering had to say about that situation. Who says this is a direct infringement on their personal rights. And also, I want you to comment on whether government should take a public stance on this. Do you think a cohesive message should be sent out that says these are, the rules that we're sticking by based on what's going on with this pandemic? Should that be a cohesive, comprehensive message being sent out? Because I feel lots of persons are duly conflicted by what you just mentioned about the labor code, and comparing that to the fact that it is still illegal to mandate someone to take the vaccine.
I'm not so sure you're correct when you say it's illegal to manage your workplace. Let's not get confused.
Well, I was making reference to the Constitution.
No. We're confusing two issues. Let's be careful. The employer cannot mandate that you take a vaccine. They cannot do that. The employer is saying, if you want to work here, then these are the rules and regulations of the workplace. If you go to work in the bank, and the bank says you need to wear a necktie to work, you need to dress a certain way. If you don't want to adhere to that, you don't have to adhere to it. You just don't end up working in that establishment. That's exactly what the principle is. The principle is that, look, these are the rules and regulations of this workplace. If you don't want to adhere to them, I don't have a problem with you not adhering to them, but I'm within my right not to employ you. Let us understand that and be clear that nobody can mandate anybody to take the vaccine. That is not possible at all. The other question that you asked with respect to whether government cannot take make such a policy. There are just too many additional issues that have to be. The government has to protect its own employees. And so the government moved out of the administration complex because there were some health-related issues. They have to protect their employees, so they moved them out to a safer place. And so it is no different when an employer says that these are the rules and regulations of the workplace, and therefore we want you to understand that we are protecting you and protecting others as well. And you adhere to it. If you don't want to adhere, you are within your constitutional right not to adhere, but we won't be able to keep you as an employee on this establishment.
Wow. I do know just around very passionate sentiments coming there from Dr. Kedrick Pickering. Of course, if you missed the full exclusive interview, you can head on over to our page 284 Media, where we spoke, I think, in excess of 30 minutes on not only the surge, but Dr. Kedrick Pickering's and health officials' passionate plea to get persons vaccinated.
Well, up next, another BVIslander has been called to the bar. We hear that story after this quick commercial break.
Is business slow, cash flow down, hosting an upcoming event? We can help. Advertise with 284 Media and take your business or event to the next level by enhancing your present marketing and messaging strategies. Allow our team of experts to create a personalized ad that sets your business apart from all the rest. This could be your business or event. So, what are you waiting for? Contact our marketing team at 284media@cctbvi.com. Advertising with us works.
Viewers, welcome back to 284 News. On a much lighter note, of course, we are celebrating another BVIslander who has been doing extremely well. Now, Mrs. Tracy Francis-Smith, a first-generation BVIslander, was called to practice as a barrister of the Eastern Caribbean Supreme Court in the Virgin Islands yesterday, July 7th, 2021. Her petition for admission was presented by Attorney-at-Law Ms. Akila Anderson of H.B. Anderson and supported by Attorney-at-Law Mrs. Rhonda Brown before the Honorable Madam Justice Vicky Ann Ellis. Now, Mrs. Francis-Smith was initially called to the Bar of England and Wales by the Honorable Society of Lincoln's Inn, of which she is a scholar, having been awarded the Kennedy's Scholarship to pursue her bar professional training course. The Honorable Society of Lincoln's Inn is one of the 4 historic inns of Court of England and Wales that educate and train barristers. The inn awards scholarships to candidates based on merit, their intellect, motivation to succeed at the bar, advocacy, and of course, personal qualities. In May of 2021, Mrs. Tracy Francis-Smith was admitted as an attorney-at-law in St. Lucia by the Eastern Caribbean Supreme Court. Her scholastic journey to the bar was intentional and, of course, very passion-driven. In 2010, she attained her bachelor's degree in political science, which, of course, is pre-law. She graduated magna cum laude, a master's degree in mass communication with a concentration in public relations in 2011. Of course, again, graduating as summa cum laude, followed by a bachelor's of laws, culminating with a master's of law in legal practice at the bar with an overall grade of very competent. Now, whilst doing the intense master's in legal practice at the bar, she represented the Manchester Metropolitan University at a client interview competition, sat on Crown Protection Service students' local scrutiny involvement panel, Manchester, where she assisted in providing perspective to very complicated hate crime cases. She also served as a BAME, that means Black, Asian, and minority ethnic ambassador at the Manchester Metropolitan University. And finally, viewers, she was also a member of the advisory board for the Faculty of Business and Law at the BAME representatives at the Manchester Metropolitan University. Mrs. Francis-Smith is a highly accomplished executive with more than 8 years experience within the offshore financial services industry as a compliance professional and money laundering reporting officer. She is also a certified anti-money laundering financial crime specialist, and international accredited civil/commercial mediator, corporate governance specialist, holds a diploma in compliance and an executive qualification in management from the University of Notre Dame. She gives all the glory and all the praises to God for her many achievements, and of course expresses great appreciation for the support of her husband, Mr. Kenny Smith, her parents, mentors, and close friends. Kamal, we continue to celebrate BVIlanders who are doing extremely well. Another woman, clearly, as we see here, called to the bar. And when you examine the trajectory of, that journey of becoming a lawyer, it is certainly one that comes with lots of challenges and that requires persistence, commitment, vim, valor, all of that good stuff. And clearly we see here that Mrs. Francis-Smith really stuck through with the journey, and now she's able to accomplish and really celebrate a huge milestone that we are all so very proud of.
Indeed. And I can also speak as it pertains to, that particular career. Was one I initially wanted to be when I was a little bit younger, but obviously my career path changed over time.
I'm glad, because then how would I have met you?
Well,
we need you here at 284 News. You'll be a lawyer later on.
Well, that's it for today's news roundup. Be sure to follow us for daily news updates at 284media.com and like us on Facebook at 284media and 284BVI on Instagram and Twitter. I'm Kamal Haynes.
And my name is Javon Wilson. I want to thank you so much for joining us and remind you to stay sanitized, safe, and socially distanced. We'll see you again tomorrow. Take care.